Before I start, I just want it fully understood. I'm not telling anybody do this or do that. I know there's certain policies on Facebook and YouTube and everywhere. I am not breaking any of those policies. I am a researcher. I'm mentioned in a lot of papers, and this is what I do. I am showing you what the current research is. That's it. I may say this might help you, or this might do this, might do that, but I am not telling you to do anything or not do anything. I'm just saying this is what the research indicates. All right? So this shouldn't be removed. I've had things removed because it didn't follow the policy. I'm not breaking any policies, I don't think. All right, please. Thank you. Okay, my friends, I've been reporting on this for years now about fecal transplants. Poop. Putting somebody that is very healthy, taking their poop and putting it just like an enema into somebody else, and then the good bacteria that's in that poop will begin to literally embed into the membranes. It's called membrane-bound bacteria. And what happens when it binds there is it eats the things that go by and breaks it down into particles that you can use as food, because it has to be tiny. You can't eat a carrot, gigantic carrot. It won't go anywhere. You need to make these into molecules, and that's what the bacteria does. And in addition, if they are being attacked by anything that's toxic, they put out mucus. Slime. And that slime protects them, but it protects you because they are embedded in your tissues. So they protect your tissues. All right, the Food and Drug is not objecting to you having fecal transplants. For a while there, they were illegal. Well, they still are, but they're not objecting because they work so well. However, last month, 2 people died from being given something with multi-drug resistant infections from the bacteria in the stool that they were given. One of them died. Now, that's because they were given something bad. This is pretty new stuff, so they're having a little bit of an issue getting started. It's just like the legality is what is worrying the patients. Where are they getting the poop from, basically, is my concern. And the doctors who practice it. Now, the FDA has allowed fecal transplants to take place, even though they're not an approved procedure, because they work extraordinarily well. And because to this point there were no bad consequences, 0, to make the agency think to rethink its permissiveness. Now, so they got some bad poop is what happens. You know what they say, anyway. Now that there's been a death, the agency might have to reconsider. No, they have to consider how it's being regulated. Because I don't know, where are they getting it from right now? I don't know. Maybe they don't know either. I have no idea. You know, anyway, they start to go through this whole thing. But here's the problem. Well, here's the real. It's not a problem. It's regulation. There's the problem. It's the regulation that we have to live under from the medical people. I've been talking about this for many years, and I've seen many successes and seen no help whatsoever from the medical industry until just recently. All right. So, but now they're saying there's no question the transplants work. They achieve a cure in something like 90% of these C. diff cases, far higher rate than for antibiotics. It's because your body will make the enzymes that do the job of the antibiotics. The antibiotics are like shooting everything with a shotgun. Anyway, in fact, one study compared them to antibiotics was stopped so early because the patients getting the transplants did so much better, it was unethical to continue saying, well, let's give it a try, let's continue seeing if we can destroy the evidence, is basically what it was. They work so well that specialty medical societies have agreed they are equivalent to drugs for recurrent C. diff, with some physicians saying that transplants should become the main treatment for the condition. Not only that, it's for almost everything, really, is what they're saying now. They're talking about it being used for almost every condition. And either I have shown you or I will show you why that is in the digestive system, what they do to protect you and what they do to feed you and what they do to create enzymes from the bacteria that live in the poop, that embed themselves in your membranes. Anyway, I'm sure I got into it, or I will get into it. Now, like I say, everything is in your gut. Now, this just today they put out from Israeli doctors. They say for the first time in the world, successfully fought cancerous tumors by changing the gut microbiome, says oncologist Dr. Ben Bourzi. Now, it goes down, it says changing the gut microbiome can reprogram the immune system. What it does is it puts back the bacteria that makes the enzymes, that makes the chemistry, that makes the products that make you healthy. And it says, they say it currently only works for 40 to 50% of the patients. Now, what they did was these people are dying. There's no hope for them whatsoever. So they figured, well, we'll give it a shot. And they took, I don't know, it was 4 or 5 people. All right, 10 people. The researchers performed fecal microbiota transplants on 10 terminally ill patients with metastatic melanoma who had not responded to anything else, had exhausted all other treatments. In the first stage, what they did was they blew out all of the patient's existing microbiome. So they killed everything, all the gut microbiome that was there. I'm not sure that's the best way, but let's go with that. After which they transplanted the gut microbiome from cancer survivors who'd had melanoma. That's no big deal. They think that just because they had melanoma and they survived it, that's not the key. If they put the microbiome from somebody that was a perfectly healthy specimen, it would be just as good as doing this. I'm almost 100% certain. I would like to see a blind study 2 ways. But anyway, they used the poop, really is what it is, from somebody that had survived this cancer. And they had responded well to the immunotherapy and who had been cancer-free for at least 1 year. Big deal being cancer-free for 1 year. They only get you a few extra years when they give you this stuff. Make it sound like it's a big deal. 2 weeks after the donor microbiome was introduced via a colonoscopy, all that is an enema. The patients, well, basically it's a little more than that. The patients had completely absorbed the microbiome and they resumed immunotherapy. And they started getting better. They kept taking the bacteria. See, that's what it is the bacteria for 3 months. This is the key. Remarkable results. Well, yeah, and then 2 years later, everything's fine. 30% response is really extraordinary. Now, so these people were going to die. Some of them were saved, but some of them died anyway. But the key is they were on death's door to start with. Secondly, they gave them a microbiota from something that I'm sure still had some other problems. Because, obviously that person was sick already. They just took something, they survived somehow for a year, and they gave them that stuff and said, oh, you'll be fine. No. Give them somebody that's healthy, really healthy. This is the key. I don't know where the thinking has gone. I really don't. Okay, my friends, I've been really looking into bacteria and the enzymes and the gut microbiome and how that affects your health, and it is literally 100% of your health. And they're admitting it. Just today, they say that they have successfully fought cancer tumors, changing the gut microbiome. That's by putting some good, healthy person's poop into somebody else's digestive system, and then that microbiome, those bacteria that are in that good poop, start to invade your tissues, literally invade them, which is good, because those bacteria do 2 things. They break down foods and stuff and break down the things that come by with chemistry, and secondly, they produce mucus. The mucus protects them from toxic stuff. If you don't have that bacteria there, you don't have the mucus. If you don't have the mucus, your tissues are subject to being invaded, and that's exactly what happens. They burn right through the walls, and lung cancer, look at this. Look at this. GI bleeding is the most common symptom, metastatic lung tumors. That's in your gut. The digestive tract, upper or lower, whereas obstruction with or without perforation frequently observed when lung cancer is involved in the small bowel. Every disease there is, if you put in your disease and then say, and digestive issues, you're going to find there's a link, 100%. 100%. Put in anything, I don't care what it is. Put in psoriasis. Let's do it. Just right there. Psoriasis and digestive issues. The link between psoriasis and digestive problems. 2.5 times more likely to get Crohn's disease. I mean, it goes on and on and on. Because your digestive system, every single molecule that goes through you, has to be broken down, and you have to be protected from it. That's it. Case closed. If you can't absorb the stuff, you can't get the nutrition. You can't get the nutrition, your body can't provide the minerals and the metals and all the things that build your body. Case number one. All right? Case number two is you've got to protect your tissues from these toxic minerals that are coming down. Normally you want to absorb them, but sometimes you don't want to absorb them. And at that time, you put out mucus. That protects you. So if you don't have the bacteria, you don't have the enzymes to break down the things you need to break down, and you do not create the mucus that you need to protect yourself from molecular invasion of the surfaces of your digestive system or anywhere. It's just like having thrown acid on you and not having any rubber to keep away from the acid. You're done. And that's what happens at stage 1, stage 2, stage 3, stage 4. It gets worse and worse and worse and worse, that's all. And then they put some good poop in the guy, and he's fine. He walks out and has a nice life. It's insanity. I think I went through this about how they replaced the gut bacteria on the people that were literally dying. They were just about dead. And then they gave them the same bacteria, which is nothing more than your gut bacteria. It's probiotics for 3 months. And they were okay. Remarkable results. Everything was fabulous. And although we emphasize the clinical benefit, we should remember that our main goal was to see if the treatment is safe and feasible. Yes, well, it is safe and it is feasible. They've known this years and years ago. Whoever put these people in charge of controlling what we're allowed to have, of something that there's no damage to it whatsoever. There was no side effects whatsoever. And this has been known for years and years, that fecal transplant has this effect to save your life. And they won't let you have it in most cases. I don't think you can still have it. And I know they say, oh, Roger, you're so critical, you're so mean, you're so nasty. Well, I have a real hard time, to be honest with you, with the people becoming controllers. All right, they're not leaders. They're not experts. They're controllers. They control what you're allowed to do and allowed to think and allowed to say. I mean, really, and I know, and there he goes again. Well, that's true. Here I go again. Okay, my friends, stick with me because this is going to be the most important few minutes you ever spent in your life. If you have any disease whatsoever, you likely have an issue with bacteria in your gut or somewhere in your body. Now, why do I say that? Bacteria creates 2 different complete things that have to be done. One of them is it has to live and eat. And when it does that, it breaks down the particles that are going by it. These specific bacteria are designed for specific places in your body. Mostly it's in your intestines, your upper lower intestines, rectum, and so forth. But there's bacteria all up and down your esophagus, your nose, all of that. Now, if that bacteria is not there, it won't eat those products, so you won't have the byproduct, which is the poop from the bacteria, which is now at a size your body can use. You won't have it. Next, if a toxic material comes in, and it comes down along this section here, and you have no way to produce mucus to protect this tissue, it's going to get toxified and get eaten right through, just like acid will eat right through it, because it literally is acid. I'm not kidding you. You know, I mean, obviously you know that. There's gastric ulcers and all kinds of digestive problems. Now, look at this. This is the other issue. Your body is 100% chemistry. That's all it is, 100% chemistry. And it is transitional chemistry. What does that mean, Roger? Well, transitional chemistry means nothing there is stable. Nothing you eat is stable. Once it goes into your stomach, it gets all broken down, busted up in little tiny pieces, and then what happens? Well, bacteria is the thing that breaks it down. First of all, you get acids. Acids break it down to a certain point where it's in particles. Well, then you go into your first part of your intestines. And that sort of brings it down to a non-acid situation where your bacteria can start to absorb it. Now, any of that bacteria is dead. You got a lot of acid coming in there. You're going to eat through those intestinal walls. It's as simple as that. I mean, this is no big mystery here. But it's the bacteria that you need. So finally, they decided to do fecal transplants. And boom, they're better. But they're using... Well, I'm going to go into that a little deeper. We're going to go into it right now. But this is the key. It's chemistry. And if it's a bacteria in your body that keeps all of that stuff working correctly. I'm telling you right now. That's what does it. It's not. The chemistry doesn't just happen by accident. It does not happen by accident. And they're organelles, yes. But bacteria is what creates these little, well, in your immune cells, they're called on by your brain to turn on the bacteria when it's needed to produce the enzymes to break the molecules down to do whatever's needed in your body. It's a vagus nerve transfers between all of this stuff, every bit of this, 100% of this. This stuff here, 100% of every single cell goes up through a nerve called the vagus nerve. It goes up to your brain. It says, hey, this guy down here's got a problem. You say, what's the matter? Well, there's some bug in here that's biting him. So we'll send down 2 pieces of zinc, and where are you going to get the zinc from? We'll go get the guy in that immune cell over there. He's the one, the bacteria guy over there. I said, okay, I'll go get him. So they go over there and get that bacteria guy. He said, we need some zinc. He said, okay, no problem. He makes the zinc. It goes back over here. It attaches to the blood. It goes by there. It finds the guy that's attacking him, and it's an enzyme, which is a little molecular package. It grabs onto him and kills him. Well, here's scenario number 2. And then you're better. Everything's fine. Here's scenario number 2. Everything starts right, and it says, hey, we got an invader down here. And he said, we'll go up the vagus nerve and talk to the brain, see what it says to do. He goes up, says to the brain, says, what do you do? He said, we'll go down and talk to the zinc-making guy over here and have him, that bacteria, squirt out some zinc, put it into the bloodstream, bring it over there, and when you find these 3 little attachment places, and they're all in this specific line, attached to it, squirt it in there and kill him. He said, okay, no problem. So he goes back down, he comes over, he says, okay, give me streptobacillus. He said, well, there is none. He said, well, what happened to him? He said, well, I don't know, the guy took some antibiotics or something. The guy, he's dead, he's gone. There is no bacillus there. He said, what are you going to do? I said, I don't know. And well, this guy's getting worse. He's getting invaded. He said, well, I can't help you. So now this guy goes back up to the vagus nerve. He says, there's no bacillus down there. And the vagus nerve says, all right, let me talk to the brain. He comes back, he says, well, what do we do now? He said, I don't know, go down there and see if you can create something else that'll sort of interfere with it a little bit and help a little bit, do what you can. And so it comes back, and it gets back to Ramus over here, and he says, can you make some stuff? He said, well, I can, but I don't think it's going to really help. He said, well, make it anyway. And he makes that, and it comes over here, and it causes some kind of tissue issue where you get some more inflammation, and nothing works. And then the guy just gets worse and worse, and then he dies. And they say, well, nothing we could have done. Well, yes, you could have. You could have had the right bacteria in there to make the correct enzyme to create the correct product or to create the correct mucus. That is the issue, my friend. And that is what has to be focused on. I'm not saying that's the end of it, it's all over. No, it's just starting. Nobody's looking at it. This is the first time they're even looking at it. They decide, oh, well, these people are going to die anyway. Let's just give them somebody else's poop that lived through the same thing they lived through. Boy, that'll make a big difference. Well, the other guy's poop could still have all kinds of problems. You want poop that has never had any issues. It's perfect. It can dissolve everything that comes through. It's got so many different types of bacteria in there, there's nothing can get by that will attack you and invade you. And I'm telling you right now, I'm 72 years old. And I've been taking probiotics and some other little things here and there. Bone meal recently, that seems to really kicked in nice. But it's all chemistry. And I have some friends and some very good friends that have kids and everything that have very, very good experiences. To me, they've been very, very, warm responses to me that they've had. It's helped their lives. Let me put it that way. It's very, very nice to hear that. And this is what I'm all about. I don't care. I'm not trying to sell anything. I couldn't care less about money or anything. I don't have much, but I don't need much. I'm a cheap date. All I want to do is just get by until I stop consuming oxygen, and then hopefully I want to find something, because I think something else is going to happen. That's my take. You have your own take. That's a whole other issue. But anyway, let's just keep going. I just do have another question. I did a study and a survey on who was getting this new virus and who was taking probiotics and who had stomach issues and so forth, which is pretty much pre-existing conditions. Now, if you were taking probiotics, I want to know, did you get COVID? So far, maybe I just missed it, but so far nobody has reported, and I've asked many times, over and over, have they had this new virus and had been a regular consumer of good quality probiotics. And I have not had anybody to report they did experience having the new virus while continuously having very good digestive conditions and taking probiotics. Now, maybe I missed it. And again, this is only just research, because if you don't get responses, you can't do any research. You can just guess. All right, so I need some people to respond. And really all I care about, I care about both sides. Yes, I've been taking probiotics, I feel much better. And that's really all I've been hearing. I mean, honestly, and I'm being fair and honest with my responses. I'm not blowing anything up that shouldn't be blown up. And I'm not telling you to take anything or do anything. But I would like to know if you have had the virus and what your response was to it. Was it quick? Did it boom, bada bang, you're all set to go? Because, everybody's going to get sick. But so far, people who've been taking probiotics have been in a pretty good condition, as far as I know. And that's what I do. I just want to know. Thank you. I love you.